probably got 2 or 3 years of really good data on it now. I think the devices have been around for longer than that. It takes a long time for something to sort of build up momentum to eventually sort of make it to market. So basically, it's a device that you look into and it bathes the eye with a specific wavelength of red light. It's low intensity, and everything that we're doing when it comes to trying to slow down myopia progression is trying to kind of change what's happening at a retinal level. It's changes in growth hormones at the retina that seem to trigger the kind of increases in eye length that result in myopia and blurry sort of distance vision. And they all work in slightly different mechanisms. The exact mechanisms are still being researched. Red light therapy seems to change the metabolism and thickness of the choroid, and it's changes in the choroid which sits underneath the retina. So it's this pink layer here that seems to be responsible. That's the thing that changes a lot when you first start becoming more myopic, and red light therapy seems to be changing that, which then governs how the sclera itself changes, which is what's involved in remodeling to make the eye bigger in most cases. There's a little bit of evidence that some people using red light therapy do get a little bit of shrinking, and we're still finding out what those sort of exact numbers are. So the exact mechanism, it's doing something to the choroid to change growth. But it's a fairly simple procedure. You're looking at a red light for 3 minutes, twice a day, 5 days a week is the ideal kind of compliance. At the moment, because it's a relatively new treatment, we're tending to use it as an adjunct therapy, and an adjunct therapy means that someone is already in a pre-existing myopia control device using an optical device, so Ortho-K nighttime contact lenses, or they're wearing daytime myopia control multifocal soft contact lenses, or they're wearing some of these newer spectacle myopia control lenses, and they may still be getting some progression that is larger or faster than we're kind of comfortable with, based on what we're trying to see where this person might end up when they're older. And so we're using the red light as an additional therapy to kind of piggyback on top of that to try and really flatten that progression out even further.
So just to be clear, so this is not something that people necessarily do in your clinic. It's actually a device that they purchase and take home and use. Is that right?
Correct. Yeah. So the one that's currently TGA approved in Australia is iRising International. And so you work through a practitioner who does a number of screenings, a number of sort of necessary measurements. We then talk about red light therapy on an individual basis based on their individual sort of situation. And if it's deemed or agreed upon that this might be a strategy that's suitable for a person, then they then deal with iRising to trial the device, and then there's an ongoing sort of subscription to kind of use it. And it's all, and iRising sort of monitors the use of the device, so we know that people, how often they're using it. It being a red light, a low-level laser, effectively, they have a lot of safety mechanisms in place in terms of, making sure the device only runs for 3 minutes, making sure that you can't do it less than 4 hours apart, and then making sure you have 2-day breaks in between a 5-day sequence of treatments.
Okay, so it's not something that somebody could just go onto Amazon and buy. They actually have to go through a controlled consultation process with a practitioner like yourself.
Absolutely, and you need to be using devices that have had a considerable amount of research and development from a safety point of view.
Right. Okay. And can you mention like some of the international work that's been done around red light therapy as it pertains to myopia?
Yeah. So whenever we talk about myopia control, we're looking at effectiveness. How much does this particular modality or protocol that you're following change how quickly your eye is getting longer compared to, when they do research, they always compare it to people who are wearing just standard myopia correction. So if we briefly step aside and go, well, what's myopia correction? Myopia correction is purely just wearing a pair of glasses so you can see clearly again. myopia control is doing something to try and slow down the changes in your myopia, and myopia management is kind of the broad base on what are we doing for a particular patient, what are all the different things that we're actually looking at to actually manage correction, manage control, those sorts of things. And so if we look at efficacy, then some of the evidence coming out is that it's quite an effective strategy for slowing progression, irrespective of what kind of correction you're currently wearing. As an adjunct therapy, it's starting to emerge on the different pre-existing lenses that we might use. Probably the strongest one that they've got so far is people who are already wearing Ortho-K. The reason they've probably got the research on Ortho-K already is Ortho-K is probably one of the longest standing myopia control strategies that we've had. I kind of almost feel like it was the one that really kick-started the whole interest in being able to slow down myopia sort of internationally. And interestingly enough, you've got people pre-existing Ortho-K wearers and people who have already got high myopia seem to be the ones who respond the strongest on average. Now, remember, it's a bit hard to extrapolate it to every single individual, but if you're looking at sort of population data, those early results seem to be quite impressive. So, it's just a matter of we've got to be careful that we don't have everyone thinking that every individual is going to respond the same way.
Yeah.